15 years ago, representatives of the governments of China, Laos, Myanmar, and Thailand met together with UNODC to sign a Memorandum of Understanding on drug control. The aim of this memorandum was to deal more effectively with what was then the growing problem of drugs in Southeast Asia. Little did they know at the time that this historical signing ceremony would form the basis for a major body of drug control cooperation in the greater Mekong subregion, which has now lasted beyond a decade and a half. Aware of the benefits of increased regional cooperation, 2 years later in 1995, another 2 countries joined the group. These were Cambodia and Vietnam. The purpose of the MOU has been to commit its signatories to combine forces and share a common view on the fight against the drug menace. They also agreed to jointly approach their partners in the international community for support in this huge task. Finally, and crucially, they themselves have committed to funding a number of these initiatives. The cornerstone of the MOU is the Sub-Regional Action Plan. The first action plan started in 1995. At that time, it consisted of a 3-year program comprised of 12 projects with a total budget of $11 million. Since then, the Sub-Regional Action Plan has become the overall umbrella for drug control cooperation among the 7 MOU signatories. It covers 5 areas. These are drug demand reduction, which is the prevention and treatment of drug abuse; counter narcotics, law enforcement operations; alternative development, which means providing sustainable livelihoods so that communities which grow poppy can move towards legitimate ways to provide for themselves; international cooperation on judicial matters; and finally is the attempt to stop the spread of HIV and AIDS, which is caused by drug abuse. In their work, the 6 MOU countries, plus UNODC, have been supported by a number of partner countries from outside the region. The most prominent of these have been Australia, Canada, Japan, Sweden, the United Kingdom, and the United States. Some financial support has also been received from other UN organizations such as UNDP, UNAIDS, UNICEF, ILO, WHO, and UNESCAP. From the start, the MOU countries have attached a high priority to combating drug production and trafficking. As a result, a number of objectives have been achieved. These have included a stronger law enforcement capability to gather and exchange drug information and intelligence. As a result of this, the MOU countries have created effective operational procedures for working together. One measure of success of MOU cooperation has been the establishment of what is known as the BLO concept. BLO means Border Liaison Office, and under the MOU, almost 70 such operational units have been created along some of the most sensitive border areas in the region. A large number of successful seizures have resulted over the years, causing disruption and imposing a high cost on the trafficking organizations. The BLO concept has become a model for replication and expansion beyond the region. Precursor control is a strategy to reduce the availability of narcotic drugs by preventing illicit drug manufacturers from obtaining the chemicals they require to manufacture them. Through the MOU, an effective precursor control strategy has been established for East and Southeast Asia. A third area of successful drug law enforcement has been through the training of large numbers of frontline officers through UNODC's innovative computer-based training using multimedia programs. To date, over 200 learning resource centers, each operated by a full-time training manager, are operating in the region. Over 85 modules are now available in 18 languages. Training has been delivered to hundreds of thousands of officers in dozens of countries in the region. To cap it all, in the year 2007, the CBT program received the UN 21 award. During the past decade, the 6 MOU countries have seen a significant shift in consumption of drugs. In Cambodia, Laos, and Thailand, the use of amphetamine-type stimulants, or ATS, has displaced opiates as the primary drug of abuse. In China, Myanmar, and Vietnam, it is also a problem alongside heroin abuse. To prevent drug use and provide users with the ability to move away from drugs, the Sub-Regional Action Plan has contributed to improving public health and economic development policies in order to reduce the drug problem and poverty among highland communities. It has also helped each country to improve its capability to respond to drug abuse among young people. It has increased the response of government and NGO groups to address the rapidly growing abuse of ATS. The result is the improvement of regional and national responses to the dual epidemics of drug abuse and HIV infection.